Hello and welcome back, my friends. If you're new here, my name is Laura, and I usually make videos about hypermobile Ehlers-Danlos syndrome to help educate, raise awareness, and share my experiences and advice living with this condition. But today I am straying away from my usual hypermobile EDS content to talk about musculocontractural Ehlers-Danlos syndrome. This is part of a video series where I give each of the 12 rarer subtypes of EDS their own introductory educational video. I have several videos out already, so please go check them out if you're interested, and stay tuned for future videos in this Rare Subtype Series. So what exactly is musculocontractural Ehlers-Danlos syndrome? Musculocontractural EDS, also known as mcEDS, is an extremely rare condition that causes multiple congenital contractures, which are birth defects that cause joints to be permanently fixed in a bent position. Clubfoot is a common example of this, as well as some characteristic craniofacial and skin features. Musculocontractural EDS belongs to a group of 13 related but separate genetic connective tissue disorders known as the Ehlers-Danlos syndromes. The hypermobile subtype of EDS, which is the type that I have, is by far the most common, accounting for about 90% of all EDS cases. The musculocontractural subtype is extremely rare and accounts for less than 1% of all EDS cases and has a prevalence of less than 1 in a million people. mcEDS is caused by genetic variants found on the CHST14 and DSE genes. These genetic variants negatively affect the way the body produces connective tissue, which provides support, protection, and structure throughout the body. Musculocontractual EDS is inherited in an autosomal recessive pattern. This means if a person inherits the genetic variant from both of their parents, they will have mcEDS. People with only one copy of the genetic variant are carriers of mcEDS, and carriers do not have the disorder themselves, but they may pass the genetic variant onto their children. Musculocontractural EDS is diagnosed through genetic testing, and genetic testing should be considered on anyone who meets the diagnostic criteria for mcEDS. The diagnostic criteria are separated into major and minor criteria. To meet the diagnostic criteria for mcEDS at birth or in early childhood, a person must meet both major criterion 1 and 2. To meet the diagnostic criteria for mcEDS in adolescence or adulthood, a person must meet both major criterion 1 and 3. Major criterion 1 is the presence of multiple congenital contractures. Major criterion 2 is the presence of characteristic craniofacial features at birth, which may include large soft spots, a large distance between the eyes, short and down-slanting palpebral fissures, which are the eyelid openings, blue sclerae, which is a bluish tint to the white part of the eyes, a short nose with an underdeveloped columella. The columella is the fleshy external end of the nasal septum, low-set and rotated ears, a high palate, which is the roof of the mouth, a long philtrum, which is the vertical indentation of the upper lip, and a thin upper lip, a small mouth, and finally, microretrognathia, which is an abnormally small lower jaw that is also displaced posteriorly in relation to the upper jaw. Major criterion 3 is the presence of characteristic skin features, including skin hyperextensibility or stretchy skin, easy bruisability, skin fragility with atrophic scars, which are scars that indent into the skin, and increased wrinkling of the palms. The 15 minor criteria include the presence of recurrent or chronic dislocations, pectus deformities, which are deformities of the chest where the chest appears caved in or out, deformities of the spine, fingers that are unusually long, slender, tapered, or cylindrically shaped, progressive foot and ankle deformities, large subcutaneous hematomas, which are large collections of blood under the skin that form after blunt force trauma injuries, chronic constipation, colonic diverticula, which are little pouches that form in the walls of the large intestine due to weak tissue, pneumothorax and or pneumohemothorax, which is when air or both air and blood leaks into the space between the lungs and the chest wall, causing the lungs to collapse, kidney and bladder stones, hydronephrosis, which is excess fluid in a kidney due to a backup of urine caused by a blockage, often kidney stones or a narrowing of the ureter, which is the tube that connects the kidneys to the bladder, undescended testicles, strabismus, also called crossed eyes, nearsightedness and astigmatism, and finally glaucoma and or increased pressure in the eyes. Because musculocontractural EDS is a genetic disorder that you're born with, There is no cure, but there are many treatment options available. mcEDS is managed by treating the various symptoms that each individual is experiencing. There's no one-size-fits-all treatment. Key aspects of care will usually focus on managing musculoskeletal and skin problems and monitoring for issues with the cardiovascular, ocular, auditory, and renal systems. That's the heart and blood vessels, eyes, ears, and kidneys. Treatment options to help manage the many symptoms of mcEDS may include medication, pain management, joint bracing, mobility aids, surgery, and physical therapy. Do you or anyone you know have musculocontractural Ehlers-Danlos syndrome? Let me know down in the comment section. I'd love to hear your story. If you thought this video was helpful, please click on the like button. If you want to see more videos like this, subscribe to my channel, and don't worry, it's completely free. If you click on the notification bell icon, you will be notified when I release new videos. As always, thanks for watching and see you next time.